Hello. So recent news had it that former President of America, Biden, has aggressive form of prostate cancer. So I decided to create this video on prostate cancer, what prostate cancer is. So prostate cancer, it's a cancer that develops in the prostate gland, and it occurs in men because men are the ones that have this prostate gland. This type of cancer develops or grows slowly. And the prostate gland, it's found in the pelvis, between the penis and the bladder, and covers the urethra. This prostate gland secretes the white thing, the thick white thing when knacking. That thick white thing when knacking, when the sperm is inside it, sperm is embedded in that thick white thing called the semen. That is what it produces. And it also controls the flow of urine from the bladder to the urethra. And that is why when you see men with prostate cancer or enlarged prostate gland, they have this issue with peeing. The common symptoms you will see is that they are straining when they are peeing. They are trying to force themselves, pushing the pee. When they pee, they feel like, they cannot pee it off. They go like, oh, I've not emptied my bladder. They will be there, touching their thing, kicking it so that the thing can come out, the pee can come out. They feel they cannot empty their bladder fully. They are frequently going to the toilet, When you see these signs or symptoms, it could be that the person is having prostate cancer or enlarged prostate, because it starts with the enlarged prostate. Because when the prostate is enlarged, it's impeding the flow of urine from the bladder to the urethra. Okay? And so, do not ignore this symptom when you see these symptoms. You need to go to the hospital. You need to see a doctor, because you can manage it at that stage when it has not developed to the prostate cancer. And so what are the causes of this prostate cancer? Usually, there is no one known or identifiable known cause, but there are risk factors that can predispose it. The factors are men who are over the age of 50 are at increased risk of having this enlarged prostate or prostate cancer. Also, it's more common in black men as well. Also, it's more common in people that have relatives that have had, or maybe your father or your mother, that has developed, or father, has developed this prostate cancer. So there's tendency it can reoccur. Also, it could be due to diet. There's a strong evidence or research has proven that diet high in calcium can predispose to obesity, to prostate cancer. Another issue is when they are obese. Obese men are highly at risk of having prostate cancer as well. So these are the factors, predisposing factors that can cause prostate cancer. And so when you report to the hospital, they have to run some series of blood tests, scan, to identify whether it has a cancer or it's just an enlarged prostate. And there can be surgery that can help, to ensure there is flow of urine, because their problem is usually the impediment in the flow of urine. And so you want to go to the hospital early enough when you see those symptoms that I've mentioned. It becomes a medical emergency when someone cannot pee at all. In 24 hours, the person cannot pee. Or even in 12 hours, the person cannot pee. Or the person is peeing out blood. It is a medical emergency. So you want to go and see your doctor. Okay? So this little information that I want to share out there for you to know. Okay? Thank you.